This is Christine Porter with Times News. I'm here with Dr. Kara Coassolo, an obstetrician with Lehigh Valley Health Network. We are talking about the safety of the COVID vaccine for pregnant women.
So, is the COVID vaccine safe for pregnant and nursing mothers?
So we do believe that the COVID vaccine is safe for pregnant and nursing mothers. It was not specifically studied in the initial studies looking at vaccine safety and side effects and efficacy of the vaccine did not include pregnant women. But we do have a lot of information that has since been gathered on pregnant women, and studies are actually going on now looking specifically at that question. There are several ways in which it's been looked at that way. One of the ways is through what's called V-Safe, which people may have heard about. It's the CDC's after vaccination health checker. And one of the questions that's asked through V-Safe is, are you pregnant? And so when you enroll, when individuals enroll in V-Safe, they continually ask about that pregnancy question. So through V-Safe, we know of over 100,000 women who have gotten the vaccine while pregnant. And many of those women are actually being followed more closely by the CDC. And what they're looking for is they want to look to see, are the side effects from the vaccine any different in pregnant women than in non-pregnant individuals? And are there any complications with their pregnancies? And in all the data that we have so far over the course of the last few months, it doesn't appear that the side effects of the vaccine are any more common in pregnant women compared to people who aren't pregnant. And their pregnancy complications do not appear to be increased. So that's all good and reassuring information.
Some people would say, okay, well, we're following them, but how do we know it's safe?
Well, the way we know that we can determine safety in anything in medicine really by following things over time. That's how we have to know about it. And when the CDC has followed this cohort of women and looking at, do they have any increased risk of miscarriage? Are their babies born any earlier? Do they have any complications such as preterm birth, any higher than what we would expect in the normal population? Because we do know that those things happen in the normal population. So what you have to look at is, look at the numbers in the women who are vaccinated from COVID and see, is it any higher than in the population? And actually those aren't any higher. So that's how we know. There are some smaller studies going on from different, universities where they're specifically following some pregnant women in their populations. Of course, those studies take months to do and to be able to publish. So information, is continuing to come out over time. Other way that we assess safety of anything in pregnancy really is based on what is the intervention and would we expect that it could potentially cause any harm. And that's how we think about other things like medications in pregnancy, for instance. With anything in medicine, there are some risks and there are some benefits, right? You wouldn't be on a medication for any disease if it didn't have the potential to help you, and it's worth taking the risk of some side effects, for instance. And that we think of with any intervention, whether it's a surgery or a medicine. So same thing in pregnancy. We have to think about what the benefits are for COVID vaccination for pregnant women, and could it outweigh any even small or potential or theoretical risk?
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.